Hello everyone, welcome back. In today's session, we'll be studying about pyloric stenosis, that is also called congenital hypertrophied pyloric stenosis. So let's start. Narrowing and obstruction of lower portion of stomach, that is also called pylorus, due to hypertrophy of pyloric circular muscle of stomach. Okay. Basically what is happening here, this one, see, can you see, normal passage was this much, this thin, but can you see in pyloric stenosis, in this portion it is hypertrophied and it is obstructing, that food is not passing from stomach to duodenum. Clear? See, narrowing and obstruction of lower portion of stomach due to hypertrophy of pyloric circular muscles of stomach. This is pyloric circular muscle. It is clear? The circular musculature of pylorus is thickened and increased in size as the shape of olive. Okay. So this is basically, you can feel also from abdomen a olive size mass. Okay. And it is a most common neonatal intra-abdominal condition requires surgery. It is the most common neonatal intra-abdominal condition which requires surgery, and it may be congenital or acquired. 5 times more common in boys than girls. So we are seeing this condition in boys, okay, than girls. Then symptoms start to seen after 3 weeks of birth. So weight of infant increase 1 to 3 weeks, and after that starts vomiting. So baby will show his or her symptoms after 3 weeks of birth. First 1 to 3 weeks we are seeing that normal weight gaining. After that baby is not taking any food and he or she is starting vomiting. Okay. So now clinical manifestation. Symptoms usually start to appear between 2 to 4 weeks of age. Vomiting progress from mild regurgitation to forceful and projectile vomiting. What is forceful and projectile vomiting? This is kind of spontaneous. Okay. Here in projectile vomiting में क्या है, कोई नॉजियस पहले मतलब जो वार्निंग वाला होता है ना कि पहले हमें नॉजियस फील होते हैं फिर आके वोमिटिंग होता है, बट इन केस ऑफ प्रोजेक्टाइल वोमिटिंग देयर इज नो वार्निंग फेज, लाइक देयर इज नो फीलिंग ऑफ नॉजियस, सडनली बेबी विल vomit. So this is called projectile vomiting, forceful and projectile vomiting. Vomiting contains gastric contents, that is milk, mucus and blood, but not contain bile, because bile कब आएगा जब duodenum is also included. But here we are seeing that passage between stomach and duodenum is blocked, so no duodenum content is there, that's why no bile is there. Clear? Like that you can remember, you have to correlate and study. Only we are taking the stomach content, right? Projectile vomiting में only stomach content will be present, that's why no bile will be seen. Okay. Olive shaped firm mass in epigastrium or right hypochondrium. जो epigastrium में है और right hypochondrium you can also feel in your abdomen as well. So there olive shaped firm mass will be felt. Then peristaltic waves are seen during or after feeding in epigastric region from left to right. You can also see a baby, if you are seeing in hospital also, sometimes baby may show that peristaltic waves are seen during or after feeding in epigastric region from left to right. Hope it is clear. Then मेटाबॉलिक एल्कालोसिस. एल्कालोसिस क्यों होगा? वोमिटिंग हो रहा है, राइट? लाइक एवरी मतलब जो एसिडिक कंटेंट था वो अगर बाहर निकल जा रहा है तो अब जो गैस्ट्रिक कंटेंट है वो अल्कोहलिक्स है ना, so that's why it is metabolic alkalosis. Child feels hungry because कुछ भी नहीं है स्टोमक में. Then constipation, greenish stool due to starvation. Clear? Now coming to diagnosis. A barium meal X-ray study reveals delayed emptying of gastric content. So we are doing barium meal X-ray, and that will show emptying of gastric contents is delayed. Now coming to management, how we are managing, that is surgical management. Pyloromyotomy, that is Friedrich-Ramstedt procedure. What is that? Incision and suture in the pylorus or pyloric sphincter through laparoscopy. So we are doing incision, then suture in the pylorus or pyloric sphincter through laparoscopy. Surgery performed within 24 hours of diagnosis. When baby is diagnosed with the pyloric stenosis, from that time to 24 hours of diagnosis, when that diagnosis has been confirmed, right? Completed and confirmed. So within 24 hours we are doing the surgery. Hope it is clear. So here we have discussed about pyloric stenosis. That is very important. They may ask you in exam, in MCQ, in broad question, in 5 marks question. Every time they have asked that short note about pyloric stenosis as well. Okay, so you have to write what is the basic things. Here it is written in brief but important points. Clear? So you can shortly revision all these topics. So we have completed pyloric stenosis. Next topic we will be discussing about, let's see, that is GERD. What is that? Gastroesophageal reflux disease, or so backflow of gastric content into the esophagus due to relaxation, that is incompetence of the muscle of the lower esophageal or cardiac sphincter of the stomach. Okay, so here what is happening? Backflow of gastric content into the esophagus due to relaxation or incompetence of the muscles of the lower esophageal or cardiac sphincter of the stomach. Causes क्या है? Transient relaxation of lower esophageal sphincter, then raised intra-abdominal pressure, delayed maturation of neuromuscular control of esophagus, hiatal hernia with incompetent sphincter. So यहाँ पे कौन सा वाला sphincter affected है? देखो पहले क्या था? पहले pyloric sphincter was affected. That's why pyloric stenosis we have seen. Here that is called, see, lower esophageal sphincter. So if you draw a diagram, suppose this is our esophagus and now it is coming our stomach, right? Yeah. So now this sphincter is affected. Okay, I am using different color. So now is lower esophageal, this sphincter will be affected. Clear? Because this is relaxed. So whatever food we have taken, that will go backflow, right? So see, or otherwise raise intra-abdominal pressure. Clear? Then delayed maturation of neuromuscular control of esophagus. So this one is mature delayed. Okay, and hiatal hernia में क्या है? जब a part of stomach it is raised, okay, not permanently, sometimes for temporarily or briefly, to diaphragm. Clear? So hiatal hernia in next class we'll be discussing in details, but for now you can remember that hiatal hernia with incompetent sphincter is also responsible for GERD. Okay, now coming to clinical manifestation. What all are the clinical manifestation? Let's see. Common symptoms include heartburn, indigestion and non-cardiac chest pain. ओके, सो पेशेंट विल कम टू यू. देखिए मैं जब भी खाना खाती हूँ ना, उसके मतलब तुरंत बाद ही मेरे को हार्टबर्न शुरू हो जाता है, इंडाइजेशन होता है, मेरे को नींद नहीं आता, ठीक है. और जो मतलब बैक साइड में जो पेन हो रहा है, तो इसको बोलते हैं नॉन कार्डियक चेस्ट पेन. ओके, देन रिकरेंट रिगर्गिटेशन, वोमिटिंग एंड हेमाटेमेसिस. पेशेंट मे कम विथ वोमिटिंग एज वेल, रिकरेंट रिगर्गिटेशन. LRI, what is LRI? That is lower respiratory infection due to aspiration. Sometimes that aspiration may affect. See, food is coming to backflow, right? So it is coming to mouth. Now what will happen? Another passage it may go to the respiratory tract, right? So that's why it may cause lower respiratory infection as well. Okay, poor weight gain and anemia due to blood loss. So heartburn will be seen, indigestion and non-cardiac chest pain will be seen, recurrent regurgitation will be seen, vomiting, hematemesis. What is hematemesis? That is blood vomiting, right? Blood will be coming out. Lower respiratory infection due to aspiration, poor weight gain and anemia. It is clear? Now coming to complication. Esophagitis, that is inflammation of esophagus, esophageal stricture, aspiration pneumonia due to aspiration of gastric content. Clear? Now coming to treatment. Keep the child in semi-upright position 25 to 45 degree after feeding and keeping supine during sleeping. Okay, so we have to keep the baby in semi-upright position, that is 25 to 45 degree after feeding. Clear? And keep supine during sleeping. In adult also, we are telling or instructing the patient that don't sleep immediately after taking a meal. That will loosen or relax your lower esophageal sphincter and food will come backflow. Clear? So same as well for the child, that we are maintaining semi-upright position, that is 25 to 45 degree after feeding, and will like जो बोलते हैं ना pat on the back. जब हम बच्चा को मतलब खिलाते हैं, that is also called burping. Okay, we also do that while मतलब after a feed, because उसके कारण क्या हो सकता है ना, वो जो रिगर्जिटेशन उसका चांसेस कम हो जाता है बच्चे का. वो जो ये हमारा स्पिंटन है ना, वो तो एडल्ट में भी अगर तुम खाने के तुरंत बाद सो जाओगे तब भी तुम्हारा रिलैक्स होने का चांस है, और वो बच्चा है तो उसका स्पिंटन ऑलरेडी मैच्योर है एंड जीआई सिस्टम उसको टाइम लगेगा नॉर्मली मतलब एडल्ट जैसा होने में. सो दैट्स व्हाई वी आर डूइंग एक्सटर्नली दैट बर्पिंग थिंग. See, here it is written, to hold the baby against the chest and pat it on the back to induce belching, also called burping. Clear? Now elevating the head of the bed 6 to 8 inches, that is 15 to 20 centimeter on blocks. Clear? Now coming to give small and frequent feeding. We are not giving मतलब मान लो 200 या 250 ml milk all together. We are not doing that. We are doing like small and frequent feeding. We are giving to the baby. Give thickened infant formula 1 tablespoon, 15 ml or 3 teaspoon rice or cereal are added in 180 ml milk. मतलब क्या है, अगर हम मतलब उसका कंसिस्टेंसी बहुत ज्यादा पतला है तो उसके लिए भी चांसेस ज्यादा होता है कि वो रिगर्जिटेट हो जाए या वो बैकफ्लो हो जाए. दैट्स व्हाई वी आर गिविंग थिकन इन्फेंट फॉर्मूला, दैट इज 1 tablespoon. सी इट इज रिटन एज वेल द कैलकुलेशन 15 ml और 3 teaspoon. 1 teaspoon is equal to 5 ml, right? Here also you can revise that part. So we are giving 3 teaspoon, that is also measured as 15 ml. Rice or cereal are added in 180 ml milk. Then avoid feeding with fatty food, chocolate, fruit juice, citrus product and spicy food. So we should not give any fatty food, chocolate, fruit juice, citrus product and spicy food to the baby. Then advise to avoid vigorous play after feeding and avoid feeding just before bedtime. हम अगर बच्चे को खिला दिया एंड उसको अलाउ कर दिया कि तुम जाके खेलो, अगर वो vigorously भी प्ले कर रहे हैं ना, उसके लिए भी चांसेस होता है कि वो बैकफ्लो हो जाए, वो बच्चा वोमिट कर जाए या उसका एसिडिटी हो जाए, है ना. तो इसके लिए वी आर नॉट डूइंग दैट एंड ऑल्सो वी आर अवॉइडिंग द फीड just before bedtime. At least maintain the time for 30 minutes. Ki after feeding we have to wait for 30 minutes, then only we will allow the baby to sleep. Clear? Now coming to surgical management, that is fundoplication. What is that? That is Nissen's operation. What is that? See, it is used to treat gastroesophageal reflux or hiatal hernia by re-establishing a gastroesophageal angle and creating a barrier to intrathoracic gastric displacement. So basically we are doing a barrier, right? We are creating another angle. See, re-establishing a gastroesophageal angle and creating a barrier to intrathoracic gastric displacement. In this surgery, fundus of stomach wrapped around the lower esophageal sphincter, that is 360-degree wrap, to prevent reflex episode. So fundus of stomach will be wrapped around the lower esophageal sphincter, that is 360 degree, मतलब पूरा घुमा के ऐसे करके, है ना? So that will cover 360 degree to prevent reflux episodes. Hope it is clear to all of you. We will be discussing about cleft lip and cleft palate. So cleft lip and cleft palate are congenital anomalies that occur due to failure of soft tissue and bony structure to fuse during embryonic development. So what is happening here? In cleft lip and cleft palate, there is a congenital anomalies, and that is occurring due to failure of soft tissue and bony structure to fuse during embryonic development. है ना? So see, in cleft lip, or also called hair lip or cheloschisis or cheloschisis, however you are pronouncing, you have to remember the spelling. Clear? So this congenital condition resulting from the faulty fusion of the median nasal process with the maxillary process. So here what is happening? Faulty fusion of median nasal process with the maxillary process. It is usually unilateral on the left side. So most commonly seen in left side. Incidence 1 in every 750 to 1000 live birth. So incidence भी कभी मतलब ज़्यादा है. More common in boys compared to girls. It is also seen in boys comparatively more. Types क्या है? Unilateral below the center of one of the nostrils. Unilateral में क्या है? You can feel also, if you have seen in any baby, I have seen in hospital sector that that baby was having difficulty in swallowing the breast milk because they can't suck, right? Like a normal baby. So there is a difficulty in feeding the baby as well, and there is a chance of infection because that otitis media and something more complication is associated with the cleft lip and cleft palate. Okay, that baby was having together the cleft lip and cleft palate, that is associated. Okay, so let's see bilateral. What is that? Below both nostrils. Unilateral में below the center of one of the nostril, bilateral में below both nostrils. Incomplete में क्या है? A notch on vermilion border of lip. Complete में क्या है? Notch up to alveolar process or ala nasi. So now cleft palate. What is that? That is also called palatoschisis. A congenital fissure in the roof of the mouth, forming a communicating passageway between mouth and nasal cavities. In cleft palate or palatoschisis, we are saying that a congenital fissure is present in the roof of the mouth. अगर जो hard palate है ना हमारा, तो उसमें होगा, है ना? Forming a communicating passageway between mouth and nasal cavities. No fusion of secondary palate or see hard palate. I have already told that you can see in the baby if you are in hospital sector working. So you make sure that you see the you find a patient with cleft lip and cleft palate. In like practical basis na, you can correlate more, and if you observe also, then also just take permission from the mother and just observe. If the baby is not your patient as well, also you should see the case. Clear? So Here, no fusion of secondary palate or hard palate to each other or to primary palate, that is called soft palate. Okay, incidence is 1 in every 2500 लाइव बर्थ. सो इसका जो इंसिडेंस है काफी कम है ना. क्लेफ्ट लिप का चांसेस ज्यादा है, दैट इज 1 in 750 लाइव बर्थ, 750 to 1000 लाइव बर्थ. एंड हेयर वी आर सीइंग दैट 1 in every 2500 live birth, more common in girls than boys. So first one, cleft lip, was more common in boys than girls, and cleft palate, it is more common in girls than boys. Clear? Causes क्या है? Viral infection during 5 to 8 weeks intrauterine life. Example है रूबेला वायरस. सो अगर मम्मी का मतलब मान लो 5 to 8 weeks जेस्टेशनल पीरियड में कुछ वायरल इन्फेक्शन हो गया था, तो उसके कारण भी ये हो सकता है. दैट इज एग्जाम्पल इट इज गिवन, दैट इज रूबेला वायरस. देन क्रोमोसोम एबनॉर्मलिटीज ऑल्सो ग्रेट फैक्टर फॉर दिस clinical condition. Then maternal smoking, alcohol intake, exposure to X-ray during pregnancy. So anything can be the cause. Clear? Mother is like a smoker, then she's taking alcohol, then exposure to X-ray during pregnancy, chromosome abnormalities, viral infection. So anything could be the cause for cleft lip and cleft palate. Now coming to management part. See, folic acid supplementation during pregnancy may decrease the risk of cleft lip and cleft palate. So again we are seeing that folic acid supplementation is very important to reduce the chance or risk of cleft lip and cleft palate. Okay, cleft lip surgery, that is called cheiloplasty. Cleft repair by Z-shaped suture line, also called Z-plasty, between 3 to 6 months before cleft palate surgery. So there will not be notch on lip. So अगर मान लो बेबी का दोनों ही प्रेजेंट है, क्लेफ्ट लिप एंड क्लेफ्ट पैलेट प्रेजेंट है, सो वी आर डूइंग क्लेफ्ट लिप सर्जरी बिफोर एट द एज ऑफ 3 to 6 months, because if you are doing cleft palate before, so there can be a chance of नॉच इन लिप. ओके, मतलब मान लो अगर तुम्हारा मेजरमेंट में या ग्रोथ जो अगर जो टिश्यू रिपेयरिंग का ग्रोथ हुआ उसमें क्या हो सकता है ना, मतलब अगर ज्यादा हो गया तो लिप कैन बी ओवरलैप एंड नॉच इज प्रेजेंट, नॉट कैन बी प्रेजेंट इन केस ऑफ that condition. So that's why to avoid that we are doing cleft lip surgery before the cleft palate surgery, and it is done or repaired by Z-shaped suture lines, also called Z-plasty, between 3 to 6 months. Hope it is clear. Cleft palate surgery में क्या है? That is also called palatoplasty. Palatoplasty में we are doing the repairment during as early as possible around 1 year of age to facilitate speech development, है ना. बच्चा 1 साल में बात करना मतलब बोलना शुरू कर देते हैं. That's why we are doing this surgery as early as possible so that baby can speak. Okay, and there is not any issue, there should not be any issue in speech development if we are doing the surgery beforehand and as early as possible. Clear? Now coming to pre-operative management, उसमें क्या करना है? Hold the child in upright position and then give formula feeding by side or back of mouth to prevent aspiration. मतलब क्या है ना? Okay, I am telling you, I have given the feeding also to that baby, so I can tell you in clinical basis. So let's see. First, you are holding the baby in upright position. Now you have to give formula feeding because baby cannot suck properly. Okay, so if that baby is trying to suck also, there is a chance of aspiration. So we are avoiding that and we are giving formula feeding to the baby. How we are giving? We are giving by side or बैक ऑफ माउथ. ओके, मतलब एक जो कॉर्नर जो माउथ है, लिप का जो एक कॉर्नर है ना, उसी एक कॉर्नर से हम देना शुरू करेंगे. ठीक है, slowly. And we have to keep extra patient with these babies with cleft lip and cleft palate, because they cannot feed fast like normal जो speed होता है बच्चे का, उससे भी कम स्पीड में वो लोग swallow करते हैं, क्योंकि उसको तकलीफ होता है ना, that's why. So we are also not only formula feeding, we are giving the breast milk as well, but it is aspirated from the mother beforehand. Like before we are doing, we are starting feeding, and we'll teach the mother as well. Clear? Now keep the baby NPO 6 hours prior to surgery. That I have told you in general basis how we are feeding the baby, right? But we are discussing here pre-operative management. So now we have to keep the baby NPO for 6 hours prior to surgery. Modify the feeding techniques according to these effects. Example, advising parent about ESSR method of feeding. What is ESSR method? That is enlarge the nipple, stimulate the suck reflex, swallow, and rest to allow to finish swallowing. Now coming to post-operative management. So let's see. That is cleft lip repair. Use lip protector device. That is a metal appliance or adhesive strips to prevent trauma to suture line. So we are using lip protector device that is made up of metal, like metal appliance or adhesive strips, both is available to prevent the trauma, to prevent any trauma to suture line. Then place the infant in non-operative side and avoid to place on repair side and prone position, because this position may cause rubbing of surgical site on the mattress. So मान लो baby का left side is common, right? So we are placing the baby on right side, non-operative side में, है ना? अब क्या है? Avoid to place on repair side and prone position, because these positions may cause rubbing of surgical site on the mattress. Then after feeding, suture line cleaned by normal saline or cotton swab. Clear? So feeding के बाद हम क्या कर रहे हैं? Suture line is cleaned by normal saline or cotton swab. Then elbow restraints may used to prevent the infant to injure surgical site. बच्चे का क्या है ना, उसको उधर अगर इरिटेशन हो रहा है, जो लिप्स के साइड में या माउथ में कुछ इरिटेशन हो रहा है, so baby can injure himself or herself, right? So that's why that self injury रोकने के लिए हम क्या कर रहे हैं? Elbow restraints यूज कर रहे हैं. Clear? Then cleft palate repair में क्या है? Avoid use of oral suction or placing sharp object into mouth and brushing of teeth. So cleft palate repair में we are avoiding oral suctioning and placing any sharp object into mouth, and brushing of teeth is also postponed. We are not doing that. Then soft elbow or jacket restraints may use to avoid touching suture line. Here in this case we are using soft elbow or jacket restraint. Okay. Then monitor for sign of infection at surgical site like redness, swelling or drainage. After surgery, child may have hearing loss due to frequent otitis media. As I have told in first itself that there is a chance of ear infection, right? So that is otitis media. That's why after surgery child may have hearing loss due to frequent otitis media. So we have to give a proper antibiotic and frequent checkup. Clear? To avoid this type of complication. So hope it is clear to all of you. If any doubt is there, please let me know. Thank you so much for hearing me.